Welcome and thanks for joining us. My guests today are Colleen Van Ham, CEO of UnitedHealthcare Dental, and John Ryan, the CEO of UnitedHealthcare Vision. And today we're going to be talking about some of kind of the unexpected or unique benefits that come with having dental and vision insurance, things that, maybe some of your customers, federal employees, military members might not know and might not immediately think about. And so let's just start right there. From each of your perspectives, what are some of those perhaps unexpected benefits of having vision and dental insurance that maybe might surprise our federal employee audience? John, why don't we start with you?
Sure. Well, thank you. I appreciate the time and the question. I think people think about vision insurance if they have glasses or they're having, kind of vision problems, which is completely understandable. But, I really think that as a country, as a society, especially federal employee program, we should be thinking about getting our eyes checked. And that's what vision insurance really is. And it's what United Healthcare Vision really promotes is the importance of your eye health, not only so that you can see and function and be the kind of best that you can be, but also the eye actually has a lot of kind of precursor of to other health conditions. So you can actually identify other diseases from cardiovascular to diabetes, not just vision correction, as we call it when you need glasses or contacts. So I think the one thing that people should really kind of think about and maybe think differently about is their eye health is very important, not just for them to function, but it can really be, kind of a precursor to tell them how they're doing otherwise. So our vision insurance plan is really focused on that member getting the care they need, making the benefits available, and then really providing all those glasses and contacts along a range that I'm sure we'll talk about in a minute. So that's one difference for us in vision.
Sure. So it's about, overall preventative health is kind of great. Colleen, how about you?
Thanks, Nicole. And first and foremost, thank you for letting us be here today. This is great. As United Healthcare Dental, we were excited to be selected to serve the FedVIP employees for the first time last year, and excited to continue this year. So I'll tag on to some of the things that John talked about in terms of the combination of how oral health plus vision health leads to overall health, and truly some of the similar things that John mentioned around diagnosis that might be able to start in the office in terms of identification. And if you think about it, it's interesting. A person might see their dentist more often than their physician. And so that's why it's a really unique thing. United Healthcare being both a medical and a dental and a vision insurer, we kind of look at the entire body. So we've learned how to really work well with our providers and network to educate them on, hey, you might want to mention this if you see this, so that that FedVIP member, their patient, can seek care the next time that they go to a physician because something was mentioned in the dental office. So I would say that that's something that's really unique about the way that we think about approaching overall health. The other thing that I'll say in terms of unique things and kind of things that we thought about when we were structuring this plan and this program for FedVIP employees last year was not only providing affordable access to dental care, but also bringing value adds to the FedVIP dental members at no cost. And one of the key features that we included in the plan was the fact that there is no waiting period to start your benefits once you're eligible on the plan. And so that's a key thing to think about when selecting a plan is you want to be able to use that benefit right away, especially if in the middle of the treatment or you have a child like me who's about to start orthodontia. It's really nice to be able to just start using that benefit right away with no waiting period, strong orthodontia benefits, and really a whole look at the member in terms of overall health. So I think that's an interesting thing to consider about the way that United Healthcare approaches benefits.
And Colleen, you touched on this just a little bit, but let's get into, maybe some of the more specific vision and dental benefits that you're specifically offering federal employees and military members in the FedVIP program. You mentioned that you're, relatively new, about a year into this or so with FedVIP specifically, but any specific benefits that, members, participants might see in the coming year or so?
Yeah, we definitely try to put as much in there as possible in order to make our plan as attractive as possible and as affordable as possible. So One of the things beyond the no waiting period and the really strong orthodontia benefits for both adult and children is UHC Dental Days, which is a mobile unit that can come on site to an agency site. So the agency benefit officers can work with UnitedHealthcare Dental and Jet Dental, which is a licensed provider of these mobile on-site benefits, and they can set that up on site. Because right now we know it's really difficult, one, to get away from work. And then two, we know that dental offices have really long waiting periods right now because of all of the care that didn't happen while those offices were closed. So that was one of the ways that we thought of in advance of even the quarantine closures to bring care to the FedVip members in a very unique way. And they'll always leave with the same kind of fun tchotchkes that you'd get in the dental office, toothbrushes and all those fun things. But what we also do is recognize that not every FedVip employee or member independent is located in the US. So we have included international coverage and made that process as easy as possible for claim submission and reimbursement in US dollars. So that was one unique thing that we were thinking about. We also know that sometimes there's a diagnosis that comes that's unexpected. So we included a critical illness benefit of $2,000 if there's a diagnosis of oral, head, or neck cancer. And that individual, knowing what they're dealing with in the rest of their life right then, probably some financial help that's quick and easy to access, we thought that might be a nice benefit to include. So they can simply call our customer service line once that diagnosis has been rendered, and they'll receive $2,000 for use as they wish. There is no limitations on how to use that. And then one additional thing, thinking about diagnoses that come and thinking about the whole person and whole person health, we did include enhanced member benefits. So for 8 chronic conditions and pregnancy, so think of asthma or diabetes or cardiovascular disease, that individual can self-identify. And we had lots of people do this from FedVip employees and their dependents last year. So that was great. And they self-identify by calling UnitedHealthcare customer service. And with one of those diagnoses, they get higher levels of exams, more frequent cleanings at no additional cost to them, does not apply to their deductible. But what we know is that during those chronic conditions, if they maintain their oral health, that will help them manage that chronic condition overall. So we encourage use of that. One last fun one that we have is the FedVip Benefit Hub, which is an online discount site. So it's all sorts of fun things. Think health and wellness, but also things like flower baskets, cookie baskets, things that I often might give as gifts. So we provide discounts to that member just by simply accessing that site. So that's just a little preview. There's a lot more out there, but that's just a few of the things that are available to the FedVip dental members.
And John, how about you from the vision side of things?
Sure. No, I appreciate it. And we've been really fortunate and appreciate the fact that we've been a vision provider for FedVip for well over 5 years now. Have enjoyed the business and really loved serving the members. Loved adding the military members not too long ago. I'm the proud parent of a U.S. serviceman. So really, it's an honor to be able to do that. So similar to Colleen and her team and her business, we keep trying to find ways in which we can make the benefit really more expansive, meet the members' needs where they are, as well as really focusing on that affordability. So a couple of things I would highlight is across our industry, UnitedHealthcare Vision provides the broadest network. And that's important in vision, very similar to what Colleen was talking about now in a pandemic time. Not as many offices are open or there's increased wait times, but UnitedHealthcare Vision has been very deliberate in creating the largest network. We have over 110,000 access points. And what that means is there's over 110,000 places that people can go to get their eyes checked and to buy glasses or contacts. And we're very deliberate in making that a mix of both retail and what we call independent eye care professionals or optometrists and opticians. And so really we want to meet the member where they want to be. If they want to be quick and easy and want to go into a large retailer like Costco, Walmart, VisionWorks, LensCrafters, we're there for them. Or if they want to focus on their local eye doctor, there's a very good chance we're going to be there for them as well, as we have a robust network there amongst those 110,000. It's about an even split. And similar, if they want inexpensive, we have kind of on the value chain, as we like to say, inexpensive places that they can go and get high quality glasses and have a very good clinical experience. But if they're a little more fashion forward and don't mind spending a little bit more money, we can meet them there as well. And then lastly, for those people who maybe don't want to deal with the human interaction or going into a store, we have a really robust online. We're still the only online provider where you can use your benefits real time with Warby Parker. Last year, in response to trying to make this network more effective, we did the same thing with 1-800-CONTACTS, the largest provider of contacts. We have our own contact lens fulfillment, uhccontacts.com, where we provide great discounts. So this issue of having a diverse network and meeting the member where they need to be is important. The two clinical things I would highlight that are very different is really around children and women who are pregnant. Recognizing, again, Colleen said it really well, we are a healthcare company first and foremost. So that's what we focus on, not just getting you glasses or contacts. So kids' eyes change. For any parent out there, their eyes can change during the year. And if they're in glasses at a young age, there's a chance they'll change. And you won't know it until maybe the grade report comes in, or you see them rubbing their eyes, or maybe there's a note from the teacher and you have to have a Zoom meeting with them. But we provide a benefit that we think is industry leading, that your children can get their eyes checked. And if it changes during the year, during the benefit year, if it changes more than 0.25 diopters, which is a clinical term for the amount of vision correction, your child is available for a new prescription at no cost. We recognize the same thing happened with pregnant women. You know, women's eyes change while they're pregnant and postpartum, and that can make their vision challenging. Now, there's many physician visits that women have to make while they are pregnant, but we do want to make sure that they do keep good check on their eyes. And if their eye changes, same thing. If they have enough of a vision correction change during their pregnancy or postpartum, we can provide them another pair of glasses with new prescription at no cost. So these are really important to us. Give a large network, meet the member where they want to be in terms of fashion and price point, but also really focus on their health, especially women and children. That's very important. And lastly, like Colleen, we're really happy to be part of the Benefit Hub. We want people to think about UnitedHealthcare Vision and Dental as a place that's thinking about their broader needs, as well as really treating them as a valuable consumer and patient.
So we actually have to take a quick break. My guests today are Colleen Van Ham, the CEO of UnitedHealthcare Dental, and John Ryan, the CEO of UnitedHealthcare Vision. I'm your moderator, Nicola Grisco, for the discussion, the unique and unexpected perks of UnitedHealthcare Dental or Vision plans, sponsored by UnitedHealthcare on Federal News Network.